Good morning, Good Life family. This is Dr. Jake Tucker at Good Life Family Chiropractic on Good Life Radio and KFOR 1240 AM, 1033 FM, coming to you live from Good Life. Okay. Let's go live. Good morning, Good Life Family Chiropractic, Good Life Radio. This is Dr. Jake Tucker coming to you on Facebook Live. We're about to begin recording the radio show. I've got a new setup, so hold in there for any technical difficulties. We are going live in 3, 2, 1. Good morning and welcome to Good Life Max Living Radio. This is Dr. Jake Tucker on KFOR 1033 FM, 1240 AM, here to talk to you today about the real definition of health. And more specifically today, we have our topic is how your insurance could be costing you your health. And here's why I bring this up. It comes from several conversations I've had this week with patients. They come into my office and they look for help. I do my exam, I take any imaging that's necessary in their case, and I make my recommendations. And then we sit down and we talk about finances. And unfortunately, when it comes to health, most people think about health in terms of cost. They think that their health costs them something. And that's the wrong way to think about it. We always talk about on this show the aspect of investing in your health, because we know that an ounce of prevention is worth a pound of cure. And so when we treat our health as a cost instead of as an investment, we do not reap the rewards of investing in our health because it ends up costing us something. And that's where health insurance is designed to come in. We pay our premiums, we pay our deductibles, we pay our coinsurance, and we pay our copay. And most of us don't even know what those terms mean. But we expect at the end of the day, when we pay those things, that when we come out the other side of the insurance tunnel, that we wind up with health. Well, that's not at all what health insurance is designed to do. Health insurance is just like your car insurance. Health insurance will not pay for your organic groceries. They will not pay for your gym membership. And they definitely will not pay for any wellness care. And what wellness care or non-medical necessity is defined as is any care that seeks to prevent disease, promote or enhance the quality or longevity of life, is not considered medically necessary and therefore will not be covered. And I'm directly quoting the Medicare guidelines on medical necessity. They exclude any care that seeks to create health. What they're designed to do is they're designed to be there in a crisis. And they do show up in a crisis. If you have a heart attack, if you have a surgery, that's where your health insurance comes in. But they definitely will not pay for those things that require us in order to be healthy. And you think about it. You think about those things. We all know that we need to diet and exercise. We know that those are requirements for health, and yet we also completely understand that health insurance is never going to pay for those things. And so I get patients in my office, and they want to be healthy, and we get them through a short portion of care, and then we say, okay, now this is your responsibility. Your health is your responsibility. And they say, what about my insurance? What do you expect the insurance is going to say? Do you expect the insurance to pay for you to be healthy and well? Definitely not. And I see people making these decisions. I actually get people on the phone that will call me up, and the first question they ask is, will you take my insurance? That is not the way you start a phone conversation. First of all, that's not polite. If I introduce myself, you also introduce yourself, and I say, how can I help you today? You don't just lead off with, do you take my insurance? No, the question is, can I help you? Because if I'm the best qualified person to take care of you and get you to health, when health is the most valuable thing in all of our lives, should it even matter if I take your insurance or not? Should it matter if I'm in network or out of network? It would be great for you financially if you could invest somebody else's money and you get the health benefits. But that's not the way insurance is designed to work. Your car insurance will not pay a single penny for your gasoline. They won't pay for your oil changes, and they sure as heck will not pay for you to realign your tires. That's not what they're designed to do. They're designed to come in the case of a car accident, just like your homeowner's insurance. They will not pay a single penny for your paint. They won't pay for tiles for your roof unless a hailstorm comes through or a windstorm comes in and blows all those things off. And then they will pay for specific things to help get your house back into living shape because it's designed for a catastrophe. You just look at the statistics in the United States right now. We spend more money on healthcare than any other country in the world. We also, just because of this Affordable Care Act that came in 2009, our health coverage rate is now up there with the best countries in the world. But health care costs are still the #1 cause of bankruptcy in the United States. And for 74% of those people, 74%, they had health insurance. And so health insurance is not going to keep you healthy. It's not going to keep you financially stable. And it's not going to ensure that you have the health that you deserve, the health that you need in order to get and stay healthy for you and your whole family. Because what health insurance is designed for and what it's based around are your symptoms. And this is the #1 cause that I think our health insurance, our healthcare system goes off the rails. We spend more money on healthcare. We take more medications. And the problem with why it doesn't work, why we're ranked 37th out of 37th, why we're ranked 74th overall when it comes to health, is because we don't even understand what health is. We don't even go to the doctor. We don't even try to use the health insurance until we feel a symptom. And while you can tell me that you're sick because you have a symptom, you cannot tell me you're healthy just because you're lacking a symptom or because you look good. I see patients all the time that have six-pack abs and pecs that the strongest man in the world would die for, that are dying on the inside, that look great on the outside. And we all know these people, the people that run marathons and keel over of a heart attack, even though the measurables were fine, even though the testing was fine. And that's the #1 cause of death in the United States right now is heart disease. Heart disease takes roughly 600 to 800,000 lives every single year. It's the #1 cause of death by far. #2 is cancer. And in both of those cases, you have the disease for 20 years on average before you experience the symptoms. 20 years. And the #1 most common symptom of heart disease is the heart attack itself. 63% of people that have heart disease will experience the heart attack before they experience any other symptoms. And unfortunately, even though we have the best emergency care in the world, it's still just a 40% survival rate for the heart attack. And so we know that the earlier we detect, the better chance we have of surviving it. And so if you go into your medical doctor and you're trying to test for heart disease or cancer, those two diseases, they can be there for 8 years, even with you getting tested every single year before our best tests can pick it up. And that's why our cancer, especially cancer mortality rate, is so bad. We measure cancer success. You've beaten cancer if you survive for 5 years, even if you die from it the next day. And this is ridiculous. The way that we think about our health is leading us down this path where our mortality rate, our longevity rates are decreasing every single year. We're dying sooner. Our kids are dying sooner. This is the first or the second year in a row where our life expectancy has gone down. And it's because we're ignoring what the real definition of health is. We talked 2 weeks ago about the Consumer Reports issue that talks specifically about the rising cost of healthcare. But the statistic that jumped out at me the most was not how much healthcare costs. It's how much our healthcare derails us. That when we go into the model with a symptom, that we have a 50% chance of leaving the hospital having had an error done to us. That the #3 cause of death in the United States right now is not strokes, it's not diabetes, it's actually medical errors. And it's because we're waiting until we feel that symptom in order to go get our health taken care of. And so what we need to come back to is what the real definition of health is. Health is 100% optimal function, 100% optimal function and healing. And there's one system that controls that. That's your nervous system. After the break, I'm going to talk about how that nervous system heals your body, how it keeps your heart beating, how it keeps your lungs breathing, how it can heal a cut on your leg. But it doesn't matter like how much of that you know and understand if you don't take action. I read books all year. I have audio books that I constantly play in my car. I'm listening to podcasts. I go to church every single weekend. If I take in all that information and I never take action, how valuable is that information to me? And so, as always, I'm always encouraging you to invest in your health. And the number one way to know that you're healthy is to know how well that nervous system is healing and functioning. And so let me encourage you right now, if you've never had your nervous system checked, to call our office, 402-413-8825. And for the first 3 callers today, we're going to do a 50% discount off of the exam and off of any necessary x-ray. Normally, that would be if you were to go to the emergency room or you were to go to one of the many imaging centers that we have here in the United States, that would cost you thousands of dollars for the process of getting the exam, having the x-rays taken, having them read and interpreted. That would cost several $1,000s. But here today, if you call my office, it would only be $130. That's my cost. But that's not a cost, that's an investment. Because what you get out of that is the knowledge with how well your body is healing and functioning. And then we use those results to build recommendations for you so that we can show you how to make sure that your nervous system heals and functions as close as possible to 100% for the rest of your life. So again, that's the first 3 callers today will get a 50% discount off of the 4-point neurological assessment, any necessary x-rays, and then the report of findings as well. And so that will be your most important visit. That's the visit where we actually show you everything that's going on, and more important, what you can do about it. So call right now, 402-413-8825. We'll get the first 3 callers a 50% discount on that exam and on those x-rays so that you can start to make sure that your body is healing and functioning at 100%. Stay tuned. Right after the break, we're going to be going through the nervous system and specifically tying it based off of the merit chart, based off of the autonomic nervous system pathway, how your body heals and functions. So stay tuned. All right, Facebook, that was a hot topic coming in. You may or may not understand the role that your insurance will play with this, but right now, I'm going into that. So here we go. Welcome back to Good Life Family Chiropractic Radio with Dr. Jake Tucker. I'm here talking today about the nervous system and how that controls your health, how it controls the function of your body, and how your insurance is not designed to integrate the information that we're covering here today into your health and into your healthcare. And so before the break, I talked about how our healthcare system is one of the sickest in the world, how it is losing the war on cancer. It's losing the war on heart disease. The American Heart Association president had a heart attack on stage in spite of you having all the information that he knows about health, about heart disease. He could not prevent heart disease in his own body. He could not prevent the heart attack in his own body because what he didn't understand and what our system fails to understand is that your health is not how you feel. It's not based on the results of a heart test because health, even heart health, is not a measurement of how well your heart beats, your blood pressure, or your pulse. What it is it's a measurement of how well it functions. Those are all functional measurements, but they're not the whole picture. Even heart rate variability, which is the best measurement that we have of heart health and your ability to overcome stresses to your heart, does not properly indicate how well your body is functioning, although it is the best measurement. And what it measures is the vagal nerve function, because what people don't realize is that for your heart to beat, for your lungs to breathe, for a cut on your leg to heal, your brain has to send a signal down the spinal cord, out the nerves to every organ, cell, and tissue in your body. And it's the same power that's in there that took 2 cells, the sperm and the egg, and created you out of it. And it started with your brain. And off of your brain grew a little tail called the spinal cord. And off of the spinal cord grew every nerve, and off of the end of every nerve grew every organ, cell, and tissue in your body. And that power didn't leave you at birth. It didn't go out and get thrown in the trash can with your placenta. That power still animates you every single day. And the second that we lose that is the second that we start to die. And we know that not just because of science, not just because of all these studies that we look at every single week. We know that because when you cut the brainstem, you die. When we cut the nerve going to the heart begins to die. But based off of the University of Colorado studies, we measured that when you put the weight of a dime of pressure on the nerve root coming off of the spinal cord, that's enough to disrupt that signal going through that nerve by 40%. If that's the nerve that goes into your heart will begin to function less than 100%. And if it's functioning, if it's getting 40% less signal than it needs, there's no way that your body can heal and function at 100%. There's no way that your heart can heal and function at 100%. And therefore, it's going to start to malfunction. And a malfunctioning heart over time leads to sickness. Sickness leads to disease, and disease leads to an early death. And so we have to stop that snowball before those flakes start collecting into that pellet. We have to stop that from rolling. And so when God designed your body, he surrounded it and protected it with the hardest substance in your body, the skeletal system. The skeletal system, bone, is actually stronger than steel in the same length. And it regenerates. It's constantly regenerating. It's slowly regenerating, but it's constantly regenerating. That's how a broken bone can heal. And your spinal column and each individual vertebra surrounds and protects your brainstem, your spinal cord, and each of the nerve roots when they come off. And that spinal column has a normal position. It should be straight up and down from the front and 345-degree curves from the side. In that position, your nervous system is 100% protected, and so it can flow, it can function at 100%. And if that's functioning at 100%, if those signals are getting to your organs, your cells, and your tissues at 100%, your body is building health. It is actively building health. It is healing cuts on your fingers and hands and legs. It is actively healing your lungs from any toxic invaders that are coming in. And so to know how well that is functioning, that's a priceless piece of information. That's a priceless piece of information. And so just like Denise, who came into my office, because I believe that every person deserves to know this information. I believe that every single person out there deserves to know how well their nervous system is healing and functioning. And so I went out, and I have community partners around the city, and I was in a store, and I had a booth set up, just a table. And I'm one of those annoying people that will jump out and say, hey, have you had your spine checked? I've done home shows at the Lancaster Event Center, and I go out and I say, hey, have you had your spine checked? And most people, they're not thinking about their health. Really, when we think about it, we wait until we feel it 100 times out of 100. We wait until there's a symptom before we think about it. But Denise, she stopped. She heard what I was saying, and she said, you know what? I think that what you're saying could actually do me some good. You see, Denise has been dealing with fibromyalgia and migraine headaches for years. And she'd gone to doctor after doctor. And she'd had her nervous system checked by other chiropractors. But what they didn't tell her is that the nervous system, it controls health, function, and healing. When it functions, then your body can heal and function. And so when we communicated that to her, the light bulb turned on. And she plugged in. She didn't just plug into the health of her nervous system and the chiropractic adjustments that would do to relieve tension on her nervous system. She plugged in all 5 of our essentials, because the essentials are essential because they're essential for health. You cannot have health without proper healing and functioning in every organ, cell, and tissue. And so we optimize that in our office through the chiropractic adjustments, through nutrition, through fitness training, through the principles of detoxing, and through a healthy mindset. Those are all things that we teach every single one of our patients in our office. And she plugged in, and she plugged in so well. And just this last week, you know, she's actually, one of the other things that's been going on with her is that she's type 2 diabetic. And I told her that we could help her with that. And she's seen some really great results. She's gotten her controlled insulin levels down below 100 on multiple occasions. And she went on a trip just about a week ago, or about a month ago, for 2 weeks. And she called her pharmacy up and she said, hey, I'm gonna need my insulin shipped down to this address. And they said, okay, great, got it. And then they shipped it to her home address instead of the address that she was at on her trip. And so she went for 2 weeks without her insulin. And even though, you know, her blood levels raised, her blood insulin levels raised, it went up to around 160. That was with without insulin. And this is a full-blown type 2 diabetic. And that's not a healthy level by any stretch. You can still be very unhealthy with those levels. But her body has gotten to a new level. It went from 300 plus without the medication down to where she can maintain 160 without the medication. And so she's been able to lower the medication that she's been on because her body's healing and functioning. And her fibromyalgia, her migraine headaches, those have all decreased as well. She's seen incredible results, and I'm just so proud of her for all the effort that she's put in. But if you're like Denise and you need the help, I invite you to call right now, 402-413-8825. Make an appointment to see how your nervous system is healing and functioning. And know that won't cost you thousands of dollars like it would in the medical system. And know your insurance probably will not cover it. But isn't your health worth more than a bunch of stockholders at an insurance company are willing to pay for? Stay tuned after the break as we go through the rest of the healing principles right after this. All right, Facebook, that's all you're getting today. If you want the last 4 minutes of today's episode, you'll have to tune in on Saturday on KFOR Radio 103.3 FM. This is Dr. Jake Tucker signing off.